has 2 children, actually been in Indiana all her life. She's been the CEO of Mental Health America for 25 of the 28 years she's been with them. And she's going to share with us today, just recently, recipient of a grant from the Youth Services Committee. But she's going to share with you a little about the impact of the Mental Health America in Tippecanoe County and the local area. Please help me welcome, if you would, Jennifer Flora.
Good afternoon.
Good afternoon.
Thank you for giving me the opportunity to come share with you what Mental Health America is all about, the programs and services we... A little closer? Is that better?
Yep.
The programs and services that we offer. We are greatly appreciative of your continued funding of the I'm Thumbody Special program. And what I'm going to talk about in the next few minutes, I'd like to begin by spending about half of my time talking about the organization as a whole and why we do what we do, because I think that's very important. Then talk a little bit about what we do, and then wrap it up telling you about the program I'm Thumbody Special. It is a fun program, and it has a great impact on young people. But to begin with the big picture first, information about our agency. Our mission is achieving better mental health in the Wabash Valley region of north central Indiana. We are currently serving, in addition to Tippecanoe County, we serve Carroll, White, Benton, Warren, and Fountain. We are governed by a volunteer board of trustees, and we are financially supported by United Way, by community donations, and by grant funding. We provide mental health education, which is our I'm Thumbody Special program is one of our education programs. We also provide mental health resources as well as self-care services. Before I share information about each of our services, again, I'd like to share with you why we do what we do. We know that 1 in 4 families are impacted by mental illness. We know that during any 12-month period of time, about 20% of us will experience some sort of a diagnosable mental health challenge. When we continue looking at some of the statistics, one of our resources for this is a publication called The State of Mental Health in America. It is published by the National Mental Health America. They do this in cooperation with the U.S. Substance Abuse and Mental Health Services Administration, the CDC being the Center for Disease Control and Prevention, as well as the Department of Education. Their 2019 report shows that Indiana is 46th in the country in the, quote, overall mental health ranking. And that's having a ranking of 46 is not good. That means that we have a high ranking of mental health issues in our state. Indiana is also 46th in the area of, quote, adults with any mental illness reporting an unmet need. That means based on the percent of adults that have mental illnesses, few of them are getting the services that they need. And that's an area of great concern locally here regarding mental health. We also ranked 43rd in our mental health professional workforce availability. We have a serious shortage of mental health providers in Tippecanoe County. The Indiana Council of Community Mental Health Centers has cited statistics showing Indiana as one of the 3 lowest states in the country in psychiatric coverage. And that, of course, refers to doctors who can write prescription medications for people experiencing serious mental illnesses. Indiana ranked the same as on public health spending, being 48 out of 50 states, are lowest in the country. So we really do have a mental health crisis here in Tippecanoe and some of the surrounding counties. The Indiana State Department of Health shows shows Tippecanoe County and most of our surrounding counties are in a mental health professional shortage area. We do not have enough psychiatrists. We know statewide that there have been years recently that there are more psychiatrists retiring than there are that are graduating from IU Med School. We know that there have been clinics in our community advertising for therapists, for counselors, for licensed clinical social workers. They've actually gone 6 months or longer without receiving one single application because, again, the number of people going into that area of work is lowering itself. We know that many people seeking mental health services today are being placed on a 6 weeks waiting list if they're lucky. Many are being placed on a 3-month, a 6-month, and we've recently heard of a 1-year waiting list. As you can imagine, if you had a close friend or family member needing mental health services, especially with children, it's so hard, and you're being told you have to wait 6 months for that first appointment, that's a huge challenge and quite serious. Again, of greatest concern may be our youth. The Indiana Youth Institute, as well as other researchers, document that Indiana is one of the top 5 states in the country when it comes to the percent of youth contemplating suicide, attempting suicide, and completing suicide. So again, some very serious mental health issues that we all need to be aware of and working to help address in our community. So that is why we do what we do. We think each of our programs are important, they're needed, and we just strive to be able to serve as many people as we possibly can in an effective way. So I mentioned that we provide supportive services. Our supportive services include, and I'm not going to list everything, but our biggest supportive services, the first is our crisis center. Many years ago, this was the Lafayette Crisis Center, and they were not able to sustain that program, and their board came to us and said, would you be able to accept this program into your agency? We did so because we had worked very closely with them for a number of years. We knew how excellent the program was and how needed it was. Last year we served over 5,000 people through our crisis center. This is a 24/7 crisis hotline. Last year was our first full year of, in addition to accepting calls, accepting text messages. Because for those of you who know any high school students, junior high school students, texting is their preferred means of communication. You can call and they may not answer that phone, but if you text, you're probably going to hear something back. So we rolled out the texting program in the high schools, and the students have been very receptive to that. I can tell you the day that our texting services started with the Crisis Center, it was about 9:30 or 10 o'clock that day. We had our first text come in from a high school student. That high school student was actually in the high school hiding at the time that they texted us. They were having a lot of suicidal thoughts. This text conversation lasted over 50 minutes. We were able to build trust with them, establish a texting relationship with them. They shared with us that not only were they having thoughts of suicide, but they had the means to complete that suicide with them. We asked them if we could contact someone in the school where they were. They eventually gave us permission to do this, and that is how we work with people that contact us. whatever amount of time it takes, whatever it takes, we will continue engaging them in conversation. We eventually had an additional person from the school. We helped them define where this person was located. Being in a small community and hearing back from that student, we know that that student ended up in counseling services. But we know our texting, in addition to our crisis line, is truly fulfilling a need in our community. The other program that I will mention today is our Navigator Program. This is a pilot program that is being funded by NCHS and United Way and the Community Foundation. It is a free service that if someone is needing services, if they have a family member needing services, they can make an appointment, come in and speak with one of our navigators, and we will help them overcome whatever barrier to services they have had in the past, and we will get them in to see a professional clinician. Navigating the mental health services delivery system can be quite a challenge, and this is the first program of its kind in the state of Indiana. And it is growing. We're having more and more referrals coming in, and we have working relationships with all of the larger clinics in our community to be able to make sure these folks are getting served. We also offer support services, support groups. We have 5 different support groups. One of these is a Spanish-speaking support group, because we know, again, that there was a great need for that in our community. Our mental health resources include free online mental health screenings that people can do any time of day or night. On our website, we have about 8 different mental health screenings for anxiety, depression, bipolar disorder, several other issues that people can screen for, one of those even being substance use disorder. We know that that is, as you all know from watching the news, that is a huge need in our community, services for people experiencing substance use disorder. We also have one of our resources as being an online human services directory. So anyone that's seeking services, whether it's mental health services or something else, they may be wanting to find out the hours of a food pantry, maybe they have a child that needs glasses. They can go to our human services directory, plug in the keyword that they're looking for, and it will list resources for that here in Lafayette, as well as some of the surrounding counties. With our mental health education programs, we offer mental health education to the general public so that folks can learn what is mental health, what is a mental illness, how do I talk to someone that may be experiencing a mental illness? If I see someone with a mental health crisis, how can I begin to intervene? If I see someone that's suicidal, how can I address this person? How can I help them? This is an evidence-based program that is being provided not just throughout the United States, but also in about 29 different countries right now, I believe. I can tell you, not only is Tippecanoe County experiencing a mental health crisis, this is really an issue we're seeing throughout our whole country as well as the world. A topic that most likely is going to continue to grow until we get a little bit of a better handle on it. We also have what is called a QPR, stands for Question, Persuade, and Refer, Suicide Prevention Program. This is a free 2-hour evidence-based accredited program. We go into quite a few businesses and will provide this to employees. We also go into a lot of schools. Last year we trained 432 school personnel in suicide prevention. We trained a total of 688 different individuals in the community in suicide prevention. We typically work with a training class size of 20 to 25 people. So as you can imagine, that's quite a few presentations. We also have a 15-hour suicide prevention training. Again, it is accredited. It's a nationally recognized evidence-based suicide prevention program called ASSIST. So I'm going to come back now to the I'm Thumbody Special program and tell you a little bit about that. That is the program that the Kiwanis have funded. I'm not sure if it's been every year, but I know it's been most years for probably about 20 years now. Bob Day had been a member of the Kiwanis, this same group, I believe. I don't know if there's folks here that remember Bob. He had been the chairperson of our board of trustees and was actually the man that hired me 25 years ago to be director of Mental Health America. Bob loved I'm Thumbody Special and was a huge backer of that. This is a 50-minute program we take into third grade classrooms. So we are giving the program to roughly 20-25 students at a time. It's not like a big school convocation or something. We want it a little bit more personal than that. There are a couple of schools in the county that want us to come in to see their second graders. For the most part, we address third graders. In a couple of schools, we're going in the second semester of second grade. Whatever the schools want is what we will try to provide to them. It's about a 50-minute program. The first 15 minutes is a little bit of an academic time. We talk about mental health. We compare it to physical health. We talk about ways that kids can stay healthy. And I can tell you, when you ask a group of 8-year-olds what they can do to stay healthy, the answers are across the board. And we always try to find a way that their answer is right. You know, we want to be reinforcing that positive. But then we compare it to mental health. And we ask them what are some ways they can stay mentally healthy. And our message to them is they can stay mentally healthy by liking themselves and respecting other people. At that point, we ask them how they respect other people, and they know. We ask them to shake hands with the person next to them and tell the person next to them that they're Thumbody Special. And to see all these little 8-year-olds shaking hands with each other, it's adorable. Some of them talking to other students in the classroom that you know they don't typically talk to, and it really breaks down some of those barriers. The middle third of the program, they see a video. It's a short 10-minute video focused on self-esteem. But during that time period, we are having them come back to the volunteers in the classroom making the presentation, and the volunteers have them put their thumb on an ink pad and then onto a bookmark. And the idea of the program is each child is as special and unique as their own thumbprint. And then we also have them put their thumbprint on a sizable poster. And that poster stays in the classroom with every single student's thumbprint on it and name under the thumbprint. If there's any students that are absent, we make sure the teacher puts their name on that poster so they know that they too are Thumbody Special, even though they missed that presentation. The last part of the program, we have each child tell us what makes them special. Some kids know right off what makes them special. They have a variety of answers. We always have a couple of kids that really don't think anything makes them special. And we work with that. And by the time we leave, they know of at least one thing that makes them very special and unique. We also tell a story near the end of it, and a few times during the presentation, they all have to scream out as loud as they can, "I'm Thumbody Special." The kids love it, the teachers love it. We get great reviews from this. Sometimes the teachers will have all of the kids write us a thank you note. The thank you notes are adorable that come back to us. So we really enjoy doing this program. One of the things that we leave in each classroom as we do the presentation is what we call a Thumbody pillow. Each year, this is a little bit different. This one has clouds, I think, on the back, clouds and flying owls or something on the back of it. Sometimes we use a different color heart. The backs are always different. There are some teachers that have about 20 of these in their windowsill, and they're all different, and we tell the children they're all very unique and special, just as the kids are. Teachers do a variety of activities with these dolls. They'll have students pass it around week by week by week to a different child, and when they give it to that child, that other student, they will have to say what makes that student special. And then that student gets to keep it on their desk for a whole week. So we have volunteers that actually make about 65 of these a year, I think. We appreciate them. We appreciate our presenters. If anyone in here would like to volunteer to do a presentation, we'll give you a great training. And I tell you, these kids really, we need all volunteers. The kids really need some more male volunteers going into the classroom. So just a little food for thought. We also pass out a booklet that the kids really enjoy doing. It has a word find in here. This thumbprint on the front is actually a maze that they can find their way from beginning to end. We do one page of the booklet during the first part of the program, and then the kids get to take it home and finish it. This is one of our bookmarks. Each year the bookmarks are different, so if there's two kids in the same family that are different ages, they each have their own bookmark. We have found that kids really do keep these because it has their thumbprint on it. We do have the teachers do an evaluation. We want to make sure that the program's meeting the students' needs, but the best evaluation or the best outcome I've ever been able to document this program with, and it's happened a few times. I can go into high schools and I can ask, I'll be talking about a specific issue, and I can ask the class, do any of you remember having an I'm Thumbody Special program presented to you when you were in 3rd grade? And I have been in a classroom where every single student started smiling. And one of them said, I got a Thumbody buttons. One of them said, I got a Thumbody bookmark. One person still had that bookmark. And they all smiled. And it's like, you know, a program's effective when a person saw it one time for 50 minutes, and 12 years later, they still remember that program. So we know that our message is taking hold. We know that students recognize they're special and unique. They're learning to like themselves as well as respect other people. And they're understanding what mental health is. We do not mention the term mental illness during these presentations. Our goal is, again, just helping them realize how important they are. We also, at one point during this program, will tell the kids, if you're feeling sad or scared or afraid, make sure you talk to an adult you trust. We are not there as that adult. We will have children tell us things, and quite often we have to report back to the teacher or the counselor what that was, but we don't sit there and talk to them about that. We tell them, you have to talk to an adult you trust. And if one adult doesn't listen, then you talk to another adult. But this program, I know, has really made a difference in a lot of kids' lives, and your support for this program is what makes it possible. So thank you very much. We appreciate it. Yes, questions? You have a question?
Yes, I was just curious, what are the reasons why Indiana scores so low in terms of mental health, whatever
Metrics.
qualifications you use for that measurement, and then is there any kind of pattern that you notice that all the states that score low have similar attributes that would contribute to mental health concerns?
When we review the State of Mental Health report, issued by the National Mental Health America, obviously, if they're low in one category, they're typically low in all the categories. For Indiana, we are very low in the number of mental health professionals we have based on population. So when you don't have enough mental health professionals, you're going to have a lot of folks that are not able to get the services that they need. That impacts people that are calling into these clinics trying to find services. It also really prevents the clinics from being able to go out and talk about mental health issues and try to expand and make different subpopulations aware that they even exist, that these clinics even exist. Indiana is low in that area. We're also very low in public health spending. The national average amount spent per person on public health by all of the states, I believe the average amount a couple of years ago was around $88. Indiana spends, and I don't have the exact numbers, but it's either around $36 or $38 per person on public health. So we are not directing money to public health, which is an important area. So there's different contributing factors to that. The mental health system as a whole can also be really complicated. Knowing which clinic to go to, and we know that there's also a stigma to mental illness, so those states that have successfully lessened that stigma may have more people seeking services. Another area of great concern, sort of ties in with that, is that the mental health clinics here in town are struggling because there is so much pressure on them to serve so many people. And the therapists that we do have, there's a huge stress on them because they know that there's so many people that they aren't able to see. And it's proving difficult all around for those folks that need services as well as those folks that are providing those services. So.
One more question. Anybody?
This is just what we needed today, to hear about something positive that's going on. So
Well,
thank you.
there are positive things going on. We started a mental health care forum about 2.5 years ago, brought together donors, the heads of mental health clinics, elected officials. We held our first meeting, didn't know if anybody'd show up. They all came. People from the courts, judges came. That's a whole different topic I didn't touch on. But there's things going on in our community that are making a difference. So I want to leave you with that happy thought. You know, we're making improvements. But thank you for supporting this program. It's been great. Great.